Greetings. I want to talk about healthcare. I haven't talked about healthcare in a good long time, and it's funny because this is going to be year 20 of being self-employed. Only in a couple of weeks, June 24th. That's when I got my business license, June 24th, 2001. And it's been an interesting time period over the years. And what's odd about this channel, and what's actually odd about my blog, my business blog, is that I have talked about and written about leadership way more than I have healthcare. Whereas healthcare has pretty much brought in almost all the money. I mean, it's an interesting thing in the fact that I've got 2 books on leadership. I've got a course on leadership. I have an evaluation module where you can evaluate employees, whether you have them already or you're going to hire, as well as managers, the criteria that you're looking for. I have a lot of stuff that I have on leadership, but I haven't done the same thing for healthcare. And I've got some reasons for that, and I've been exploring those reasons. The main reason is because every time I started thinking about putting something together, I started to come up with way more stuff than my mind says anyone wants to read, and I really don't want to spend the time putting into it. And, you know, healthcare finance is an interesting thing. I'm not talking about what chief financial officers do, which is mainly budgeting. I don't do that. I am not an accountant. I can do it because I actually was an accountant for like 6 to 8 months many years ago, but it was at it wasn't at a hospital. It was at a healthcare facility, but it wasn't in a hospital. So it's a different animal, and I wasn't the guy in charge. I just did accounting. And I've always understood accounting. I'm good at numbers, but that's not what I wanted to do. Healthcare finance is a finite industry. There's not a lot of people who can do everything that I can do. Started out as a biller, moved up to assistant supervisor, where I then added in registration. I was a regional manager for a physician billing company. Then I was a director at 2 different facilities where not only was I over medical billing, but I was also over diagnosis coding, charge master, a lot of stuff. I was the revenue guy. That's just what I did. At one of the hospitals, not only was I all that stuff, but I was also a compliance officer. And, you know, that was actually when my first look at working and teaching people leadership came from, which is the last place. And as I've traveled around the country over the last 20 years, I've done some very interesting things. You know, people say you shouldn't brag about your stuff, but you got to tell about your stuff. So at one hospital in 53 weeks, I helped them increase their revenue by $730 million. Think about that for a bit. $730 million increase. The day I got there, they were bringing in $1.9 million a year. The day I left, they were bringing in $3.9 million a year. Thank you very much. So I met with a lot of different people at a lot of different departments, at a lot of different levels, working to try to help this hospital find their revenue. And it was there. They just didn't understand how it worked. They didn't understand how to capture it. They never even thought about it. Why? Because a lot of hospitals across the country go to the directors of, our terminology is ancillary departments. These are the people who actually, you know, do the procedures. They go to all these directors and they say, okay, you're going to be responsible for your charges. Which sounds good, but you can't make someone responsible for something and not give them the tools to know what they're supposed to do with it. That's just moronic. It's like you go to school and the teacher basically says, okay, you need to write me a report on the Civil War, and I'm not giving you any books, and you can't go to the library, and you have to sit here for an hour and a half and write it. And you can say that, but folks may have heard of the Civil War, but one, can you write a full paper on the Civil War in an hour and a half? And 2, without having some kind of background or had someone who's shown you how this is supposed to work, what kind of job are you going to do? There may be a couple of geniuses out there who might get A's, but the majority are probably going to get F's. You're not even going to get the D minus. You're going to get an F. And that happens in healthcare. There's a lot of directors who have no idea. There's some who do, and boy, you appreciate those folks. But a lot of them don't, because in their minds, they're supposed to be concentrating on how to do the job and how to take care of the patients. They don't really care as much about charge capture, although they know that part's important. But if there's any changes to charges, which happens every year for every single department, sometimes it's a big change, sometimes it's a small change, but there's changes. And if you haven't looked at your stuff for basically 3 or 4 years, you might be billing for stuff that no longer exists, or maybe the language has changed and what you're billing for isn't exactly what you're doing. And probably only 20 to 25% of the hospitals across the country have a charge master person. And it ain't gonna be a small hospital. Sometimes it's not even a big hospital. The hospital where I helped them get $730 million increase in 1 year didn't have a charge master person for 18 months because the powers that be had no idea what a charge master was, so they figured they could just hire an accountant and say, here, go do charge master. And that poor person didn't have a chance. So that's where we're at. And I decided, you know what? It's time for me to do more videos on healthcare. It's time for me to probably ask the people who are in healthcare, or even those who aren't in healthcare, what would you like to learn? What would you like to know? And I'm still looking at doing this course. I'm trying to decide how I want to do it. Do I want to do it via a membership site? Do I want to create an online course? I'm not really sure about that. I've got to clarify that before I create anything. I'm not in a position anymore where I can do a lot of travel. Matter of fact, if I travel to a place once a month, that's probably the best I can do. Luckily, we have online things like Zoom. I can't even remember what the other one was called now. Isn't that a shame? Began with an S. That's all I remember. But we have Zoom. We have other things. You've got something called Screencast-O-Matic, where if someone needs to be trained, I can actually show it on my computer wherever they are. I don't have to travel to do almost any of the work I do. Heck, we got telephones. Y'all remember telephones? We can do that. But it's time. You know, what's odd about this channel, like I said, most of the videos have been on leadership. I've only done 20 on healthcare, and some of those haven't really been healthcare finance. They've just been talking about my experiences in healthcare, being a black man, which is scary, but there you go. And the funny thing is, the 3 most popular videos that I've done on this channel are all related to healthcare. And one of them, which is called What is a Charge Master, is the #1 video on YouTube for Charge Master. Yeah, I did that. So there's going to be more of those. And the frequency isn't going to change. It's going to be 1 video a week. I'm probably going to hit a topic. But like I said, if you're in healthcare and you're thinking about something that has to do with the financial part and you want me to talk about it or you want to learn about it, y'all let me know. Matter of fact, if you're a hospital, if you're working at a hospital and you check out some of the videos that I've done regarding healthcare finance, especially Charge Master, and you want somebody, y'all know how to reach me. My link is down below that leads to my business page, and my phone number is there. And my email is somewhere on there. Anyway, that's what I got today. My name is Mitch Mitchell. I hope y'all have a wonderful week, and I hope we get to talk with each other. Y'all take care.